As healthcare workers, we're needed at the bedside. And if nurses and physicians and respiratory therapists are now furloughed at home, who's going to take care of the patients? This is a national emergency. And we're here in the front line, and all we're asking for is to make sure that our patients are safe, we're safe, so that we don't take this virus home to our families and to our communities. We're running out of masks. Nurses right now are having to call management to get a mask. There's not enough gowns or gloves. They're placing these patients in droplet isolation. We don't know what this virus is about. And so as healthcare workers, if we're not safe, we can't keep our patients safe. We want the employer to make sure that the nurses and other healthcare workers have the PPE, the personal protective equipment that's necessary to take care of these patients.
Protect patients! Protect nurses! Protect patients! Protect nurses! Protect patients! Protect nurses! Protect patients! What do we want? N95! When do we want it? Now!
We've been asking Kaiser for several years to do N95 fit testing on the nurses. One of the problems with what's happening now is that we were not prepared. The nurses were not fit tested, so now they're trying to do it quickly when we're in this emergency, which is not the ideal time to do it. What needed to happen was that the nurses were fit tested prior to the emergency. Now we're just trying to do it in the emergency. The fit testing for these N95 are what they just gave me that came from the hardware store because we don't have any or enough, don't necessarily fit me. So when I'm fit tested, it doesn't fit around my face enough to prevent me from airborne diseases. So I need what's called a PAPR, a positive air pressure respirator. These are the big hoods that you see with the air blowing through it. Those are what you need to use when you're doing procedures that aerosol the disease, and we don't have enough of those. So not only do we not have enough N95, we don't have enough PAPRs either.
It's been a fight. Nurses are frustrated. There's mixed messages. The information that comes from management is very confusing, and it changes from shift to shift. And so all the nurses are asking for, is to make sure that they are protected, that they have the highest level of protection possible, which is a Cal OSHA standard, which means put them in the negative pressure rooms for airborne isolation. We need to have N95 masks or PAPRs. PAPRs is the powered air purified respirators. They need to have gowns. They need to have gloves. They need to have somebody watching them don and doff their PPE so that we don't infect ourselves.